All right, tonight we're going to talk about fibromyalgia, how to use nutrition acupuncture to take back your life. So I just want to say that I did see a couple of questions already came in. I had a quick peek at them. We're absolutely going to cover those at the end of the workshop tonight. Fibromyalgia is a chronic condition characterized by widespread muscle and joint pain, fatigue, and tenderness in localized areas. It used to be diagnosed if a person had certain key points that were tender. Symptoms include fatigue, poor sleep, memory problems, low mood, which could be mistaken for depression. And people just don't feel good. They just don't feel well. Associated conditions are tension headaches, TMJ problems, irritable bowel, anxiety, and depression. So that means they aren't necessarily part of the fibromyalgia, but they're just things that are often found together with them. And since fibromyalgia isn't really a clinical or not really a specific diagnosis like the flu or pneumonia, it's hard to say what is part of it and what is just an associated condition. But these are usually generally travelers of the same path. Fibromyalgia, the word is derived from the Latin word fibro, meaning fibrosis tissue. And fibrous tissue is just tissue that is non-functioning. So if a person had an injury to their stomach and the stomach didn't heal, well, fibrous tissue would lay there and it would be non-functioning stomach tissue. Just like if you have a scar on your arm or your leg, well, it's not really functioning perfectly like skin. It's this filler type non-functioning tissue. And it's the Greek term for myo, meaning muscle, and algia, meaning pain. So it's anyhow, it's the fibrous part of the tissue affecting the muscles and causing pain. Symptoms often begin after a physical trauma, like an auto accident or an assault, surgery, infection, and significant psychological stresses. Many times patients will, when they report the condition, they say, I was fine, doctor, and then I had this surgery, and after the surgery, I started to develop all these conditions. People come into your office and they've had maybe a medical treatment, maybe an injection of some time. And they say, you know, since I've had that injection, now I'm having all these additional symptoms. Sometimes there's just a slow onset of symptoms with no identifiable cause. Now, unfortunately, fibromyalgia affects women more often than men. And since there is no known cause, since the cause hasn't been identified, there, of course, is no known cure, and treatment focuses on symptomatic relief. Now, when you're dealing with symptomatic relief, that means you have to think long-term in terms of your treatment, and you want to use treatments that people can live with over the long term. One type of treatment is drug use. We call this working against nature. This often leads people into so-called recreational drugs, marijuana, CBD. Alcohol has been used for centuries, or at least for hundreds of years, for this type of condition. Psychiatric drugs are just prescribed because the doctor doesn't know what else to do. And opioids, of course, leading to the opioid epidemic. Recommended lifestyle changes, we call that working with nature. Regular, low-intensity exercise, such as walking. Avoiding damp, cold environments. Staying warm. Reducing contact with unpleasant or difficult persons has often been helpful. Taking a news holiday. A news holiday means taking a break from the news, usually shutting off social media for a week, not watching the TV news, and avoiding the email news blast that everybody seems to want to send you. Playing musical instrument or singing has a very healthful effect, and it does indeed reduce the symptoms. Eliminating sugar, reducing carbs, and eating more vegetables also has shown to help many people. And sauna, up to 3 sessions a week, up to tolerance up to 60 minutes is also helpful. If you're taking a sauna, you want to make sure you have plenty of electrolytes, which includes salt and potassium, and you want to keep under to 60 minutes. Lifestyle changes are often not enough, and drugs may cause more problems than they're worth. Fortunately, several studies have shown that improving nutrition can reduce the frequency and severity of fibromyalgia symptoms. In a review of over 400 studies found that the stimulation of certain acupuncture points was more effective in relieving pain in both the short-term and long-term when compared to conventional medicine. This is an outstanding result. And if you have patients that have this condition, they probably are taking medications, and they're probably trying to get off the medications, which is how they entered your office. So combining the nutrition and the acupressure points is a powerful treatment, and you shouldn't neglect it in your own mind or let the patient neglect it in their mind. When patients come into my office and I introduce them to acupressure, I ask them if they've ever heard of acupuncture, and they said they have, and I ask them if they've ever had a treatment. Maybe they have, maybe they haven't. I ask them what the result was. Whether the result was good or they didn't seem to get results, I remind them that acupuncture and acupressure is over 6,000 years old and has been gaining in popularity, is more popular today than at any time in history. So it is possible to fool some of the people some of the time, but it is very unlikely that for 6,000 years you can continue to fool greater and greater amounts of people. The truth is, acupuncture and acupressure work, and they work very well. The key is the number of treatments. A person may require, 90 treatments. Well, geez, that may sound like a lot, and it is. And when the patient thinks about it, the first thing they think, well, gee, what's the cost of that? And even if the cost isn't an issue, they might think, well, I don't have the time to come to the office for 90 treatments. And that's why we use the videos, the online videos, which you assign to the patient. And so now the patient, you can say, great, I want you to do 2 treatments a day for 30 days. Boom, in a month, they're into 60 treatments, and they're well into their 90 treatments. So our job is not necessarily to invent new treatments, and certainly not to compete with medication because they're having their own problems, but merely to deploy treatments that have worked for 10, 20, 30, 40 decades and thousands of years. Okay, in this webinar, I'm going to show you the supplements and acupuncture points that I recommend for those with fibromyalgia symptoms. And here is the quick reference guide. This is the link over here that your patients can find the video. And Ben sent you a new copy where the link works. The original one you got, the link didn't work. So if you get today's one, you're all set. Here's the one that helps them understand what how to find an acupuncture point, such as discussing terms like anterior and posterior, discussing terms like lateral and medial, and discussing the fabulous soon or the proportional inch. Over here are the points we're going to cover in detail. And over here are the supplements. And again, this program is remarkable for its simplicity. Lifestyle recommendations, low intensity exercise such as walking, avoiding damp, cold environments, staying warm, as I talked to you about before, reducing contact with unpleasant persons, and so forth. So this is right in the handout, as well as the medical advice disclaimer. And if you can permit me a short advertisement, I have created these videos for your patients, neurological recovery, there's courses, online courses for your patients, neurological recovery, improving erections, new hope for Alzheimer's, and relieving wrist pain, carpal tunnel syndrome. So if you'd like to offer those to your patients, just reach out to me and I'll show you how you can offer those. And of course, you would get a a piece of the price of the supplement, the course, should they buy it. Neuroplex is the first supplement that I recommend, and it's 3 twice a day on an empty stomach. Neuroplex supports the nervous system, supports cognitive functioning, and contains a broad spectrum of vitamins, minerals, and complementary tissues to support endocrine organ function. The next product is Min-Chex, 3 twice a day. It's a combination of minerals and what they call synergistic factors designed to support the nervous system. This is another completely unique standard process product. It contains organically bound minerals as well as bull testicle extract in a package to help people calm their body. The minerals, we know the alkaline minerals are very calming on the body. However, minerals are a rock, and so digestion is a little bit of an issue. And so when you combine it with the extract from bull testicle, which includes the penetrating factor, then the minerals dive deeper into the system and it's much more effective. Cardio Plus, 3 twice a day on an empty stomach. Those of you that are familiar with standard process products know that the key part of Cardio Plus is cardiotrophin PMG, which not only helps heart muscle, but every other muscle in the body, and reduces the inflammation in every other muscle in the body and reduces the propensity to chronic conditions. Supports healthy functioning of the heart and other muscles, supports coronary blood flow, and supports increased oxygen demand during exercise. This, of course, is another very unique standard process product. And if you talk to Ben or Keith, or even look online, you find the really interesting components. Now, the next product is Super EEF, 2 twice a day. Super EF supports the central and peripheral nervous system. So we know that the human brain, the 60% of the dry weight of the human brain is made out of fatty tissue. So when you lower fats, like in a low-fat diet, and when you lower cholesterol, such as with certain medications, then one of the first casualties is the nervous system. And the biggest part of the nervous system is the brain. The human brain contains 60% of all the cholesterol, contains 20% of all the cholesterol in the human body. And so as we're all seduced into these low-fat diets and seduced into these low cholesterol programs, the brain is the casualty, and it's leading the stage for the onslaught of Alzheimer's and dementia. Super EF is a really unique product because you need fats. You need healthy fats, essential fatty acids. But the problem is, the older you get, the less you can digest fats. So Super EF is a pre-digested fat. It's not oily at all. It comes in a dry capsule with a dry powder, but it gives you the essential fats that you need, gives your patient the essential fats they need for their muscles and for the nervous system. A really unique product that I believe has been helping people for close to 40 years. Ben can correct me on that if he needs to. Also consider, so that was the full program. These are the also considers depending upon the patient's condition and need. The first here is lactic acid yeast wafers, 3 twice a day. It cleanses and promotes healthy function of the lower GI tract. It prepares the tract to have great biotics in there. Tuna omega oil, 3 twice a day. It supports concentration, supports skin and hair health, and supports emotional balance. Vertigo Complex contains herbs traditionally used to promote skin, promote healthy blood circulation, support healthy capillaries, and it supports the body's natural ability to adapt to temporary stress. So even stressed out people, sometimes they have more stress, and that's when you want to give them the Vertigo Complex for at least 60 days. So if a person has a stressful event, you start the Vertigo Complex and you say, take it for 60 days. The next is Adrenal Complex, 1/2 tab, 4 times a day. This is the best way to take it. I love this. I've talked about it many times and I use it a lot in my practice. It is the stress tab. I like my patients to suck on that tab, get that licorice taste, let that licorice coat their throat, let it coat their stomach. It's very, very healing for anyone who has acid reflux, H. pylori, any type of stomach conditions. It's very healing. It's intended to restore adrenal gland function, support adrenal gland health, and help the body adapt to the challenges of everyday life. Okay, for pain. So let's say that pain is the central feature of this person's fibromyalgia. Well, now we're going to go with calcium lactate tablets. And that does include magnesium. It's built right in there. And it's 2 twice a day. Supports muscle and nerve conduction. Supports maintenance and function of cell membranes. Supports proper function of enzyme systems. Supports and helps maintain healthy bone density and formation. Additional support for immune system function. So it provides additional support for immune system function. And then finally, Easy Mag, if a person needs additional magnesium, 6 tabs a day. It's a plant-based organic magnesium. It supports patients with inadequate dietary magnesium intake. Magnesium is essential for central nervous system health. It's involved with sleep. So you can just test the patient, give them a bottle of this stuff. If they start seeing more relaxed, more comfortable, then you know they need this product. Maybe give it to them for a month or 2 and then see if you can phase them off. But you want to be backfilling with the calcium lactate before you stop this particular product. Okay, Chlorophyll Complex supports multiple body systems. I suggest people chew 1 or 2 every 2 to 4 hours as needed. This is remarkable. If you ever have pain, acute pain, you should try this. Take 2 capsules, break them in your mouth, chew them, hold them in your mouth for about a minute, and then swallow and wash down with water. Wait maybe 5 minutes, then walk around, move your body, and most people will be quite surprised that the pain is less. And so the dose is 1 to 2 every 2 to 4 hours. So you start high dose is 2 every 2 hours, and then you start fading down as a person needs it. Chlorophyll Complex also boosts the pain, reducing effect of pain medications. It's really a miracle product. Okay, Zypan 2 with each meal, supports digestion, supports gastric health, provides enzyme for proper protein digestion, supports the environment of the GI tract. So it helps leaky gut, helps get the protein you need to rebuild your body, and that's why it's included in the fibromyalgia protocol. And then we have the natural treatment for fibromyalgia, and that's in the video I'm going to show you now.
Hello. In the next few minutes, I'm going to show you a research-proven method to reduce the symptoms associated with fibromyalgia. Widespread muscle and joint pains are the keynote of fibromyalgia. The pain is often accompanied by fatigue, trouble sleeping, and difficulty concentrating, depression, and anxiety. Quality of life can be seriously affected, leading to a loss of ability to participate in everyday activities, and can have a negative impact on relationships with family, friends, and people at work. Studies have also shown that fibromyalgia is associated with obesity and inability to lose weight. In this video, I'm going to show you how to use 3 acupuncture points to relieve pain and start enjoying life again. A review of over 400 studies found that the stimulation of certain acupuncture points was more effective in relieving pain both in the short term and in the long term when compared to conventional medicine. The stimulation of acupuncture points was found to be a safe and effective treatment for those with fibromyalgia. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this information, please give me a thumbs up, subscribe, and hit the bell icon to be alerted to new videos as they come out. The first acupuncture point that I want to introduce is small intestine 3. Small intestine 3 is used to relieve neurological conditions and to relieve stress-related pains. Small intestine 3 is known as the stiff neck point because of its marked effect on relieving neck pain and stiffness. Small intestine 3 is also used to reduce eye strain, as well as to relieve pain in the hands and arms. Many people have reported a general sense of calmness after stimulating small intestine 3. To locate small intestine 3, relax your right hand and point it up towards the ceiling. On the pinky finger side of your hand, find the depression that is just below the knuckle of your pinky finger. Push into this area to find a spot that is tender or painful. That is small intestine 3. It might be slightly up, down, or to one side. Activate small intestine 3 by rubbing it rapidly 5 times. Then take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. In a moment, I will introduce you to a powerful acupuncture protocol known as the 4 gates. The 4 gates protocol is usually used with herbal extracts for optimal results. The 4 gates protocol is known to strongly relax the body, balance energy circulation, and relieve pain anywhere in the body. It is called the 4 gates protocol because it opens 4 gateways of energy, 1 in each hand and 1 in each foot. Opening the 4 gates can flush the body with vital energy. When opened, the 4 gates can lead to sensations of energy and lightness in various parts of the body. The first acupuncture point in the 4 gates is large intestine 4 on the hands. Large intestine 4 is one of the most popular acupuncture points and is used to treat any condition in the head, like headaches, allergy symptoms, toothaches, nosebleeds, and to sharpen vision. Large intestine 4 is also used for constipation, to ease stress on the lungs, such as in asthma, and to induce labor. Large intestine 4 is not recommended during pregnancy, but might be helpful if delivery is overdue and one has been advised to induce labor. To locate large intestine 4, look at the back of your right hand. Notice the fold of skin between your thumb and your hand. Press into the end of this fold and locate a tender spot. That is large intestine 4. It might be slightly higher, lower, or to one side. Activate large intestine 4 by rubbing it rapidly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tei Shin, it might look like this. Now find large intestine 4 on your left hand and repeat. After activating large intestine 4, stand tall, turn your head from side to side, and notice if your head feels a little looser. Liver 3 is the foot point in the 4 gates protocol. By itself, liver 3 is quite powerful and is used for migraine headaches, high blood pressure, muscle tension, and vertigo. Liver 3 is also used for menstrual difficulties, insomnia, and to help balance hormones. To locate liver 3 on your left foot, put your index finger in the space between the great toe and the next toe. Then you move your finger towards your leg. On top of your foot, you will feel your finger between 2 bones. Continue to move towards your leg till it seems like those 2 bones come together. Press in that area and find a spot that is tender or painful. That is liver 3. Activate liver 3 by rubbing it rapidly 5 times. Take a break for a count of 5 and repeat 5 more times. It might look like this. Or, if you have a Tei Shin, it might look like this. Now find liver 3 on your right foot and repeat. Now move your feet and legs around, see if they feel lighter, adjust for it less. Combining small intestine 3 with the 4 gates protocol can be a start to a pain-free body and a happier life. I suggest that you activate these points 4 times a day for 30 days to get fast relief, then activate them twice a day for the next 90 days to stabilize results and continue progress. For additional natural remedies, be sure to check out my video, Fibromyalgia.
That completes the video. I'd be happy to answer any questions that I can.
All right. Again, anyone who has any questions regarding anything we saw, the nutrition, the herbs, or the points, please put them in the Q&A box. Dr. Baritz, I know you saw the first couple questions.
I'm
Did you
just
want to
going
go
to
ahead
answer
with those?
that first one. What I'm going to do is I can create there's an outline, a PowerPoint outline I can create and then send it over to you. Hopefully that will satisfy, Dr. Green. But anyhow, I'm going to make a note of that and I'll create that and send it out.
Okay, great.
And then let's see, outline.
Are you ready for the next one?
I sure am.
Can you explain, if you can, simply, it might be a little too complex or maybe not, the difference between fibromyalgia and chronic fatigue syndrome?
Yes. So neither of those are definitive diagnoses such as pneumonia, streptococcus, or a fracture. So they're really just a collection of symptoms and they got arbitrarily grouped together. People with chronic fatigue syndrome may have more aches and pains than normal people, and people with fibro may be a little more fatigued. But people with fibro, the accent is more on the muscle body aches and pains, and they may or may not have fatigue. And people with chronic fatigue syndrome, the accent, of course, is on this crushing fatigue. My heart goes out to those people, and they may not have fibromyalgia. So that's the best answer I can give. I'm not sure anyone can give anything much better than that.
Yeah, I mean, I would just lend toward that, like you said, the general description of fibromyalgia is the pain and the muscular pain that's systemic, and the inflammation with chronic fatigue is really more based on the adrenal glands, thyroid, endocrine, and this dysregulation of endocrine support and the complete collapse of the adrenals on top of it. So if you ever did like saliva testing or muscle testing, you would see the cortisol, norepinephrine, all those levels are out of balance. And the fatigue is the last stage pre-Addison's disease. Next question, just clarification, super EFF versus EEF on one of the slides.
Yes, well, that again shows my weakness for spelling.
And that people are paying attention.
And that's good.
And you embed that in purpose to make sure people are paying attention.
I only wish I was that smart, Ted.
I know you did it. Would you want to give 9 tuna and 4 EFF a day? Is that too much fatty acids? Please discuss.
Okay, it's absolutely not too much fatty acids. Most people, because this is good, clean fatty acids, most people don't get near enough. And so I think that's, not as long as they can stomach it, they can digest it, you're in great shape.
And if I can speak to that, truly, it's not too much, because a lot of literature and research is pushing people toward things like a paleo diet or a Mediterranean diet or some of these other, keto diets, all these different diets that are lower in carbohydrate. And we feel that upwards of 30% of one's diet should be fats. And so imagine, just say 1,500 to 2,500 calories a day, you're getting very few in 4 super EFF and 9 tuna omega oil. What they're doing is supplementing a diet that we presuppose is already eating fat and either not processing well in the case of super EFF with the liver issues, or just simply not getting enough omega fats in the diet, which most people by a large margin do not get. And therefore 9 tuna omega oil, for example, and combining them is not an issue at all. You could do a lot more. Just think of all the fats you would eat during the course of the day. Next question. I have a mother-daughter client with constipation and diarrhea issues, so traditional irritable bowel syndrome. The daughter is muscle testing with transverse colon weakness. As I eliminate inflammatory foods and rebalance their digestive tracts, are there specific points that may help them along the way? And I'm guessing points being acupressure points.
Yes, of course. So I actually have two videos. I have a diarrhea video, how to stop diarrhea after eating. And I can send the link over to anyone who needs it. But the name of it is How to Stop Diarrhea After Eating. And the other one is Acupressure for Constipation Relief. So Acupressure for Constipation Relief focuses on Heart 7, Conception Vessel 14, and Spleen 2. And the diarrhea video is Spleen 6, Governing Vessel 20, and the Hall of Impressions.
Great. Awesome. Here's a different question. May I ask what one would charge for the acupressure combined with an adjustment, or how, any thoughts on that in terms of how one bills for that?
If you want to, maybe just take a look what you're charging for your physical therapy or physiotherapy, but it's not out of the question to charge 50%. So if your adjustment, say, is $60, then you might combine that with a $30 charge. I mean, the fact is, the adjustment charge includes the pre-adjustment period where you're, talking to the patient and making the assessments. Then you provide the treatment, and the post-adjustment where you're checking the results. So a little of that is already, so the pre-acupressure is kind of already taken care of. Anyhow, I don't think it would be a problem if you're combining it to add, 50%. So a $90 adjustment would become a $30 treatment. No,
Okay.
I'm sorry. A $60 adjustment would become a $90 treatment.
Okay. Well, yeah, it's a good ballpark.
Yeah.
Next question. Does the tuna omega, I don't know if this is for you or for me, does the tuna omega make people tired because of the DHA EPA ratio?
I'm definitely going to let you take that one, Ben.
Yeah, I've never heard of that before. What you're talking about is pressed oil from tuna fish, and you're getting milligrams of oil. Eating a spoonful of fish oil wouldn't make one tired and negatively impact fatigue. It certainly would put a little bit of work together on the gallbladder, which has to excrete bile to break down those fatty acids into usable prostaglandins and other forms of fat. But fatigue would be very strange combination, when talking about digesting food. It's not, there's no tryptophan or something in there. But if you want to elaborate on that question, we're happy to discuss it further. Are the videos for constipation and diarrhea on your YouTube channel?
Yes, they are.
Great. Here's one. What is the balance for calcium lactate and easy mag?
Oh, well, calcium lactate keeps a person up to their normal level of magnesium and calcium. If a person needs additional magnesium because they're showing signs of needing additional magnesium, then you add the easy mag to the calcium lactate tablets, and then most people will be able to come up to the calcium lactate tablets once they've filled up with magnesium, after maybe a month or 2 or 3 months.
Great. Yes. I like this next question. This is a good one. are there any points on the hands for vertigo for patients who can't reach their foot?
What a great question. Yes, there are. There's actually, I don't know if I can, let me do a quick look for you. You know, there's a whole type of acupuncture, acupressure called Korean acupressure. You may or may not have heard it, but in Korean acupressure, they do all the points on the hand. And it's really, really quite interesting. If you can just see my hand over here, and if you think of it like an anteater like this, so this would be the head, you know, neck, over here is the back. This would be the front leg, back leg, and back leg. Or, well, that's an animal, but so this would be the head, arm, and hand, leg, and leg. So if you really understand this system, you can really treat any condition you treat with traditional acupressure with the hand. And sometimes it's super useful because people can't reach their hand or the points are uncomfortable. You know, for there's a fabulous point for seizure and unconsciousness. If a person is unconscious and the point happens to be in the perineum. And I got to tell you, I don't care how serious the situation, if you're going to be start poking somebody's perineum when they're unconscious, you know, you're going to end up in jail. But if you want to treat that point, it happens to be right over here, right here on the wrist. And
could
so
you raise your hand a little?
Yeah. So it's right here on the wrist. Can you see that?
Yep.
And that is the point for, you know, unconsciousness. Of course, if a person's unconscious, a lot of other things have to happen, and the EMTs have to be called in. But if it's a person that's, you know, a family member or somebody close enough to you, and you're allowed to put your hands on them, that would be a great point to start stimulating.
Great. That's great. Thank you. Here's just a general question. Do you do allergy tests or food sensitivities? Any way to check if certain foods causing these symptoms? What do you use? I think I know the answer, but I'll let you go.
Yeah, I use an NRT testing.
Yep.
And that's what I test for.
So what Dr. Baritz is a master nutrition response tester, advanced nutrition response tester, and they have a wonderful test kit. If you're interested in that, you can get it from Ulan Nutritional Systems. And if you have a question about how to order that, just shoot me an email. It's a test kit that has multiple foods in it and allows the practitioner to test that to the person and see if there are any sensitivities or weaknesses show up. And then you can correct those and then retest them in the future and see that they can then tolerate many of those foods that they at one point could not tolerate. Is that correct, Dr. Baritz?
That is correct.
All right.
I have a quick question.
Yeah.
What was that? Somebody had a question about, was there a point on the hand for somebody who couldn't reach their foot?
Yes.
I don't think I answered that, but I would like to answer that. What was the question again?
Is there any point on the hands for vertigo for patients, which, you know, comes with chronic fatigue and sometimes fibromyalgia, for a patient who can't reach their foot?
Well, as it turns out, let me take a look. Yes. Triple Energizer or Triple Heater 3. And I'm going to show that to you now. So can you see my hand?
Yep.
And you see here's the small finger, and here is the ring finger, and here is the knuckle. And I'm coming up till I'm in the little spot just below the knuckles. And if you push in there,
raise your hand up, just another.
Yep,
perfect.
And if you push in there, you're going to find a spot that can be incredibly tender. So you don't want to, you know, hurt the patient, but that's the point. I'd get right in there and treat it. And I think you're going to find it's going to help.
Great. And then, you know, so any other questions? We're going to wrap up. There was one last one because we're kind of over time. Said, can you do a Gerd protocol today. I don't know if we have digestion coming up soon, and if so, you could hold till then, or if you'd like to answer that.
Have we done a GERD webinar?
No.
We haven't. Oh my goodness. Well, I think that's a huge gap. If other people want it, I would love to do a GERD webinar, either the following, yeah, I would love to add a GERD webinar. I'm not sure what's coming up next, but it could be the next one or the one after that. If people like that idea, just, click in and give me a GERD or something like that.
Great. So GERD would be great. Just came in. They're all scheduled. Yes, GERD. GERD.
Great.
All
Well,
right.
we'll definitely do one, either the next or the one following it.
Cool. Great. All right. Well, thank you, everyone.